Hey guys, Bix Weir, Road.com. Got a copy of the Reopening America. Opening up America again. This is the plan guideline. Um, Watch the politicians scramble. Watch the governors scramble. Basically, the first states that open up are going to do the best. And the states that open up last, although they want to politically save their political position in as far as the reelection to have the economy destroyed, it's going to get really interesting. But here it is. I think Trump's talking about this today. Proposed state or regional gating criteria. This is the things they have to satisfy before they're allowed, supposedly, according to the governor. Now the governors get to make this decision. One, symptoms have a downward trajectory of influenza-like illness reported within a 14-day period, or the same with COVID-like syndromic cases reported in a 14-day period. So it has to have 14 days of going downhill. Watch everybody start rigging their numbers down now. They were rigging it up before, now they're going to rig it down. Except New York, because they probably want, Cuomo wants to probably run for president. The only way Democrats to win would be if the system is destroyed before that. Number two, cases, the downward trajectory of documented cases. Basically, he's saying this because he knows everybody's going to start going down once he says this, so that they have the 14 days. So we'll be open by May 1st, which is probably exactly what should be done. Hospitals, treat all patients without crisis care. Robust testing program in place for at-risk healthcare workers. Now, this is going state by state or region by region. And it says state and local officials may need to tailor the application of these criteria to local circumstances. Metropolitan areas that have suffered severe COVID outbreaks, rural and suburban areas where outbreaks have not occurred or have been mild. Additionally, where appropriate, governors should work on a regional basis to satisfy these criteria to progress through the phases outlined below. Imagine the pressure on the politicians, on the governors and the state officials and on the local officials to open up again. Everybody, you're going to see these curves just go straight down, which is great. And yes, they were rigged straight up. State preparedness responsibilities, testing and contact tracing. The states have to have the ability to set up safe and efficient screenings and testings for symptomatic individuals, ability to test symptomatic indicated persons for COVID or trace contacts of COVID results, ensure sentinel surveillance sites are screened for asymptomatic cases and contacts for COVID and trace. Basically, you got to be able to test. And then the healthcare capacity, ability to quickly and independently supply sufficient personal protective equipment and ICU capacity. And they have to have plans, protect for the health and safety of workers, protect for the health and safety of living and working in high-risk facilities, protect employees and users of mass transport, basically protection. Okay, you're going to see this is going to be the fastest rollout by these state and local governors. And at some point, nobody knows the real numbers of how many people contracted it and how many people died. Most likely, it is much lower because no one's gone outside. Much lower than what they say, especially in New York. But on the same thing, if New York's not allowed to open up by their governor, Trump he's got Cuomo in a little problem here. Right now, Cuomo said, oh, it's Trump. It's all Trump. And I'm dealing with a crisis here. It's going to be up to him to reopen. So Trump has done a good idea by putting it all on the governors. It's your guys' call. And that way they can't blame him. All right, proposed phased approach based on up-to-date data and readiness, mitigates risk of resurgence, protects the most vulnerable. It will resurge. It will spread, and it will be pretty dangerous in a lot of areas, but we have to move on. It will always be like this for the rest of our lives. A bioweapon was released, and we're stuck with it. Implementation on statewide or county-by-county basis at governor's discretion. And everybody in that state's going to say, I have to go to work. Open up our country, our state. So all the numbers are going to go just down a cliff. Watch. Guidelines for all phases for individuals. 1, continue to practice good hygiene. All the stuff we've been doing. Don't touch your face. Wash your hands. Sneeze into a tissue. Disinfect. Strongly consider using face coverings while in public. Why not? Why not? Nobody wants to see your ugly mug anyway. I know they don't want to see mine. People who feel sick, stay home. Absolutely. And this is, truthfully, this is the way we should be living anyway. Now, guidelines for all phases of employers. Develop and implement appropriate policies. Yes, all of a sudden HR comes into play, and HR has got to set up this whole thing for social distancing, temperature checks, testing, sanitation, use of disinfectant, business travel, monitor the workforce for symptoms, develop and implement policies and procedures. That's all HR. Human Resources Department, go to work. That's what they love to do. Policies and procedures. All right, here we go. Phase 1 for the states and regions. Once they satisfy all that stuff, here's how they're going to open up. All vulnerable individuals should consider shelter in place. They should have done that anyway. Leave it up to the individuals to make that call. This is free America. Members of households with vulnerable residents should be aware that by returning to work or other environments when distancing is not practical, they could carry the virus. Same thing as, hey, take care of those people who are vulnerable. All individuals, when in public, should maximize physical distancing, social settings of more than 10 people. Should. They're not saying the Gestapo's coming down. They should. Where appropriate, distancing may not be practical, should be avoided unless precautionary measures are observed. Avoid socializing in groups of more than 10 people. Not illegal. Avoid it. These are the recommendations. Minimize non-essential travel, obviously. Phase 1 for the employers. Continue to encourage telework, return to work in phases, close common areas, minimize non-essential travel, strongly consider special accommodations for your vulnerable employees. Specific types of employers. This is interesting because, there's a zillion different types of employers, and they only named a few. Schools and organized youth activities that are currently closed should remain closed in phase 1. Visits to senior citizens, obviously don't do that. Large venues, sit-down dining, movie theaters, sporting venues, and places of worship can operate under strict physical distancing protocols. Can operate. There we go. That's a big one. Because people are tired of sitting at home. So they'll probably go every 4 seats you can, unless you're with your own family that you live with, you got to sit 4 seats away, that type of thing. And the restaurants will open, like they'll put a bunch of the tables and chairs away and they'll spread it out and it'll last for like a couple days. And then they'll go back to, hey, we need more tables. Elective surgeries can resume. Gyms can open if they adhere to strict physical distancing, sanitation. Bars should remain closed. Why should bars remain closed? Why can't the bars stay open with physical distancing? Kind of like prohibition. They don't want everybody to go out and get hammered. This is going to piss off bar owners, by the way. That's phase 1. Phase 2, for states and regions with no evidence of a rebound that can satisfy the gating criteria a second time. So I don't know, phase 2, is that 14 more days? I don't know. All vulnerable individuals should shelter in place. All individuals when in public should maximize physical distance. Non-essential travel can resume in phase 2. For the employers, encourage teleworking, same stuff, common areas, non-essential travel, and specific types of employers. This is basically saying what we're going to open up. Schools and organized youth activities can reopen in phase 2. I think that would be probably like 14 days and another 14 days, if I'm reading this right. So mid-May. Senior care facilities and hospitals should be prohibited. Sure. That's the most vulnerable part of the population. Large venues can operate under moderate physical distancing protocols. Same thing. Probably then everybody will be wearing masks and gloves if you don't want to get sick. If you don't care, you don't wear anything. Elective surgeries can resume as clinically appropriate. Gyms can remain open if they adhere to strict distancing protocols. Bars may operate with diminished standing room occupancy where applicable and appropriate. So bars finally get back into the mix. Phase 2, mid-May, most likely. Everything's going to change. People are going to go out and say, there's nothing wrong. I've got no problem at my place. Come on in. And then all of a sudden you'll have an outbreak. So keep an eye on that. Phase 3 for states and regions with no evidence of a rebound that satisfy the gating criteria third time. So that's another 2 weeks? Probably, yeah, 2 weeks. Excuse me. Phase 3 individuals. vulnerable individuals, same old. Unrestricted staffing of employers. We're going to live with this forever. So people are going to get it. Your smartest thing is to buy liposomal vitamin C, vitamin D, zinc, chaga mushroom powder, and build up your defenses. How long have I been saying that? How long has Cliff been telling us that? Since December. Thank God for that, right? All right. And then that's it. Phase 3, everything's back open. Let's see. Large venues, sit-down dining, movie theaters, sporting events, places of worship can operate under limited physical distancing protocols. So that would be 2 weeks from here, I think. We're going to find out because Trump's going to go on TV and tell everybody. If you want to find out more about what's really going on, check out the first thing at Road to Ruta. I posted Cliff's right below the Epic Times documentary of who did it and why this bioweapon was created, which is a great documentary. And right below it is Cliff High explaining more about, yes, it's a bioweapon. Anybody who said it wasn't a bioweapon is full of shit. So there you have it. Go to roadtoruta.com, check that out, and don't forget to subscribe right here. Public Lord, free updates right on the left side. All right, get your free updates, emails on what's going on, what's going down on the Road to Ruta. Lots of good silver stuff coming up. Lots of good crypto stuff coming up I'll be talking about as the internal banking system implodes and the derivative market breaks down. So make sure you sign up right there and like and subscribe to my YouTube videos. YouTube is trying to ban all people trying to spread truth. They take away, some people say, I thought I was subscribed, and they took the subscription out. So give me a thumbs up and hit subscribe and send it to your friends. And get a bell. Click that little bell under YouTube so you get notified. This is Bix. I'll talk to you later.